large head or macrocephaly. In fact, when a baby is born, the average occipital-frontal circumference of the baby is 35 centimeter. At 1 year, it becomes 47 centimeter. At 2 years, it is 49 centimeters. And 3 years, 50. And at 6 years or so, it is 54, 53 something. So, adult occipital frontal circumference, that is head circumference, is achieved at 5 to 6 years. So the brain growth takes place in first 2 years of life, thereby myelination, and then size of the head is important. And male female there is a little bit difference, 1 to 2 centimeter more in the male. And the what are the causes of large head? Macrocephaly. It is familial or genetics at times in 2/3 of the cases. Isolated and non-familial in another how much? It's around 20% of cases. And your genetic cases causes like autistic spectrum disorder, the achondroplasia, hypochondroplasia, and your neurocutaneous syndrome like tuberous sclerosis, neurofibromatosis, metabolic disorders like mucopolysaccharidosis, hypothyroidism, and white matter disease like metaphasia, metachromatic leukodystrophy, Alexander disease, that do have a little bit larger head. When the brain for the CSF flow is obstructed, quite common, little bit hydrocephalus, the secondary to infection, the brain, and at times it is congenital. Hydrocephalus and larger head, ventricular system dilatation, head giving rise to the higher amount of CSF, and large head is quite little common, and is one of the important cause of neurodevelopmental disorders and large head. Apart from that, we have the non-communicating hydrocephalus. Choroids is less common, a little bit benign intracranial increment of the CSF, hematoma, the arteriovenous anastomosis, your bone disease, metaphyseal dysplasia, bone dysplasia, others, thalassemia, and brain tumors. Finally, they are the important causes of the large head. So, clinical features of this large head are the underlying disease features and the CNS involvement. If there is lesions, the deficient CNS lesions in the cranial nerves, your cerebral lesions, your others, visual path, fundus, pupil, depends upon the site of the lesion. Their representation like. Apart from that, you have craniotapes in rickets. So it's not the enlarged head, it is the anterior frontally, which is a little bit delayed closed, and the bone is not well developed because of the vitamin D and calcium deficiency. So the how to investigate, and certainly below 2 years you have open frontally, you do one ultrasound, exclude the underlying pathology, and your X-ray skull, see the raised ICP, intracranial pressure, and finally investigations for the underlying disease. Treatment also depends upon underlying disease.